Hey, brown babes. Akila here. Just wanted to let you know that this week's episode is going to be a favorite. We call these the classic Well Honestly episodes. It is a repeat, but I think it's chock full of information for you all to absorb again. We will see you in new episodes in the future. Bye.
Hey, brown beauties. Welcome to Well Honestly, the podcast. I'm Andretta.
And I'm Akila, and we're your hosts. Well, honestly, what is this podcast all about?
Our show is about women doing better tomorrow than they are doing today, so we can take control of our health. We give you real talk and educate you on all things related to health, mental wellness, and nutrition for brown women all over the world. Once you know what choices you have, you can do better, because we know the struggle is real.
We invite you to come as you are, but leave inspired to become your best healthy self. So let's get started.
Hey, brown babes. We're
Hello,
back.
everybody.
This is episode 11.
11, girl.
Hey, Keela, how are you?
Hey, girl. I'm good, girl. How you be?
I'm fantastic, girl. So we are being consistent with these podcasts.
We are. How has your week been? Let's talk about that real quick.
It's actually been good. I got caught up, after my trip there to help you get situated in Texas, and I'm back out here doing my day job and also working with Brown Women Wellness, which, by the way, the Facebook group is continuing to grow. We gained 20 more members this week.
Our Instagram is doing the same. Our Instagram has grown to about 150 in the past.
Oh.
So, yeah.
Oh, so you're trying to outdo my little Facebook group thing here?
I'm just trying to be like you when I grow up. That's all.
For those of you who don't know, I actually run the Facebook group portion of Brown Women Wellness, and Akila runs the Instagram because, Instagram is her jam. That's what millennials love, them some Instagram. They say that the old people ran them off of Facebook.
Y'all did. But you know who's been trying to... Okay, so TikTok. People are trying to get me onto TikTok. And I'm resisting it. I feel like, why? But it's been popping. I don't know.
Look, it's very, don't worry, they're going to pull you in just like Clubhouse pulled me in. They're going to pull you in. Trust and believe that social media thing. It's just so many social media outlets.
Was that real when they said that the Russians were stealing information from TikTok?
Is that what you stuck on that part?
No, girl, because my information is out there.
Oh, yeah. I was going to tell you, Big Brother already got all your information.
Yeah, I ain't worried about all that. But I just don't know much about it.
Well, I'm sure you will figure it out if you want to.
Brown Wellness might be on TikTok very soon.
Oh, yeah. Well, we're on LinkedIn, and we are also starting a Pinterest channel, too. I know it's a lot of stuff going on. And on Pinterest, though, we're going to put some recipes on there. So that's going to be fun. But and it's going to help us with our new venture. A lot of people don't know we are in the back kitchen doing some stuff. So, yeah, Keela told me to be quiet.
Not secret, because you like to spill the beans.
I'm not going to spill the beans until we're ready.
All
right, so let's talk about what we're going to talk about on this episode. Today, we actually have a special guest.
Yes, we do. We are interviewing Dr. Shante Griggs, who is a RPHD and PharmD. Lots of important acronyms.
Yeah, she's a pharmacist, a naprapath doctor, educator, author, political organizer, and a community revolutionary. Hey, let the revolution begin. Hey, especially when it comes to health. Oh, yeah, I'm ready to let the revolution begin. So anyway, but we are excited. We're going to talk to Dr. Griggs about all of her endeavors. But before we do that, let's get into this mindset moment. Again, that's our, we are, we're trying to set our mindset here. And so we mentioned it on episode 10. So we're going to continue on this mindset moment on episode 11.
Yes.
And so remember, what's that? We're going to continue to say our little slogan. What is it? If you don't run your subconscious mind yourself, someone else will run it for you.
Let that be a theme.
Okay.
Let that be a thing, because it's something that we need to constantly keep in the forefront. You get what I did there? Is that if you don't run your subconscious mind, everything else will run it for you. And essentially, you're letting other people control your life. So let's not do that.
I actually have a mindset story I want to share real fast.
Well, go right.
Okay. So you all know that I also have another career, and it in actually it's real estate. And so real estate, you got to have your own career. You make your own money. It depends on how you approach it. Okay. I don't care. They can tell you all the systems and everything you want, but if you don't have the right mindset, you will fail at it. And I was in year 10 and I was kind of stuck, and I needed an abundance mindset. I wanted to make more money in what I was doing at that time. So I took that and I studied and started doing affirmations on abundance. I started watching what I say and what I thought about. And I'm going to tell you something, it worked. It worked. It took about maybe, it was a shift. It was a mindset shift. And I did it with my thoughts. I always thought about ahead of time what my clients were going to do. How many clients did I want? How much money did I want to make that year? I started writing it down. I remember, Keela, we were writing down 25 times what our affirmations were. We talked about this in another episode, and it worked. I just want you to know that I did it and it worked. And so now I continue that abundance mindset. So I just want to let you know that mindset does work, but you got to believe it too. You got to put some action with it.
Also, I want to challenge everybody and let us know how this goes. Go to our Facebook group or our Instagram, or you can email us at hello@willhonestlypodcast.com. But I want to challenge everybody this week coming up. One affirmation. When you get up in the morning, after you say your prayers or your thank yous, repeat that affirmation to yourself. When you get in the mirror work is important, because when you get in the mirror and you're brushing your teeth or you're looking at yourself as you get yourself together, look directly at yourself and repeat that affirmation. Take a breath and repeat it. Because if you're saying it to your reflection and you're really feeling it, that's powerful affirmation. It's called mirror work. So just one, and let it be an I am statement. Let it be something that is already in existence. So one of my favorites is I am well. It's simple. It's effective. It's to the point. And well-being can be anything that I wanted. And then from I am well, I just go into a stream. So now it's to the point where when I look at myself, it just flows out my tongue. And I mean it, because I'm looking at myself, which is basically self-love, and I'm affirming what I want and who I am. And so now my subconscious, even when I start to have anxious subconscious thoughts, what I've been training kicks in and kind of cancels out what I used to do all the time, which is to overthink and be anxious. So I want you guys to do that this week. Let us know what your affirmation is. Let us know how you feel about it. We really want to make this like a thing, because that's the key to your whole journey.
I like that. I like that, Miss Keela. I like that. Okay, we're going to take a break, and then we're going to come back and we're going to interview Dr. Shante Griggs. Are you tired of being tired? Are you aching, have pain in unexplained places? At the root of all diseases like diabetes and high blood pressure and many more is chronic inflammation. There are 10 wild-crafted organic hand-picked herbs in the Be Well anti-inflammation tea that will help calm those flames. Go to brownwomenwellness.com and get 15% off by putting in the code WellHonest15. Okay, we're back. Now, I'm going to read some of this stuff because Dr. Griggs has quite a bio here, but I'm going to read some of this before we get into our interview. She received her Doctor of Pharmacy from the University of Illinois, Chicago College of Pharmacy. She also has a Doctor of Naprapathy, degree from the National College of Naprapathic Medicine. She has dedicated 17 years to this practice, her community practice. She taught 2008 to 2010 at Chicago State University at the College of Pharmacy. She also is committed to a doctorate program in the field of naprapath. And Dr. Shante Griggs has taken both of her very cherished medical backgrounds collectively to be at the forefront of complementary integrative medicine. Oh, that's my thing right there. That's my jam, integrative medicine. So inspired by her own challenges with back pain and pregnancy over years, it led her to her doctorate thesis in treatment of lower back pain during pregnancy, the application of naprapath medicine in treating muscle spasms. So she did a lot of research in this area. So we are so excited. She has a book series coming up called Mommy Hurts, where she shares her personal experiences in miscarriage and recurrent pregnancy loss. She even talks about divorce, bankruptcy, bad credit, single parenthood, and child loss. Oh, she's not leaving out anything. Oh, this is going to be a good interview. Oh, by the way, currently she sits as the president of the National College of Naprapathic Medicine. And she also serves on the board and vice president for the American Naprapath Association. Wow, she has a lot to talk about. Welcome, Dr. Griggs. Are you there, Dr. Griggs?
Thank you guys for having me.
Fantastic.
Thank you for being here.
Yeah, I want to start with this one question before we get into the real interview. We want you to explain to our listeners what naprapath is.
Oh, I'm always excited about explaining to people about the field and the profession of naprapathy. Now, naprapathy is a specialty of preventative and non-invasive manual medicine that doesn't employ the use of medication, painful injections, or surgery in its treatment protocols. Naprapathy, it complements any and every form of medicine on the planet. I like to say that. Now, you notice I say naprapathy. I'm saying that.
Yeah, you're saying it better than I said it.
I'm not surprised. A lot of people, if they pronounce it right the first time, we're actually shocked. So we understand. But that's naprapathy with a P for pain relief, and to not be confused with the other field of natural medicine, which is naturopathy or the naturopath.
Okay.
Sometimes we pronounce the naturopath as naturopath, which sounds like naprapath.
Oh, okay.
So you learned something new.
I just learned something.
Yeah.
Okay.
Yes. And so in our marketing campaigns now, we say naprapath with a P for pain relief. So we add that in the pronunciation of the specialist. So as a naprapathic doctor, I am by clinical definition a connective tissue specialist. Now, connective tissue is a type of tissue inside of the body that is found throughout the entire body. It is the tissue most often that's cut away in surgery, but that's actually connecting to the other tissues of the body. So as a naprapath, not only am I correcting and restoring tissue health as it relates to connective tissues, but also nerve tissue, muscle tissue, bone tissue, etc.
Interesting.
So we're restoring tissue health.
Interesting.
As naprapath.
Interesting. Very interesting.
It's more down that rabbit hole. I'm going to take you guys down the rabbit hole.
Let's go. We're ready to go with you.
So of course, we're restoring tissue health as naprapaths. And there's three main ways that I like to describe and how we do that. And then the first way is through targeted nutrition and assisting our patients back to an optimal state of health, because we understand the importance of the micronutrients in a lot of the biochemical processes and in the development of new tissue in the body. So we already know that blood cells are always being reformed and redeveloped, pretty much every cell in the body, but I just use that as an example for today. But just think about that. If we were to employ proper nutrition in a more consistent and habitual way, you can essentially create new cells every 90 to 120 days.
Say that louder for the people in the back about the new cells creating, because I think a lot of people don't know that we regenerate these new cells all the time. All the time.
Yes.
It's something I learned in my intermediate fasting. So yes, I love it. Love it. Love it. Keep going.
Yes, they stress that to us through pharmacy school a lot. That cycle is 28 to 35 days as far as a range, as far as it takes for the production of new cells in the body. And the cell is the most simplest basic form of life. It's just that we tend to get more complex in our thinking. We're thinking of organs and organ systems, but if you were to break them down, it is going to go back to that cell. So if you can reproduce that cell every 28 to 35 days, then yes, you can make yourself whole again.
Love it,
But I
love
won't
it,
get too
love
much
it.
into that.
Yeah, love
But
it.
that is just one of the ways that, as a naprapath, just one of the ways in our specialty as how we are helping restore tissue health with people, and that is through the targeted nutrition. Now, the next way that we're helping to restore and correct tissue health is through spinal correction and alignment. So we provide treatments to each individual vertebra of the spinal cord, and that's from C1 through S1. Our treatments are very gentle, and we incorporate myofascial release techniques and stretching to assist in correcting and aligning the spinal column, as well as the pelvis. Because see, the pelvis is the seat of the spine. So as long as that is in order, now everything that follows up can be aligned. And then now that helps with just the normal flow. I want to say the flow of energy, but if we're going to speak scientifically, just when you're thinking of nerve conduction and how it's going out to stimulate the different extremities of the body, if that spinal column is aligned, it allows it for that to take place a lot easier. So if you have an infringed nerve, if you have some type of disc issues, something's going on there, it can affect how different organ systems are functioning if it's not getting the proper nerve conduction. I'm trying to find the words for that, but yeah. That's essentially what is that we're doing. So there's no high velocity.
I'm sorry.
There's no worries. There's no high velocity thrusting or cracking of any sorts in our medicine, and we work with the connective tissues to accomplish this in our goals of spinal alignment and correction. And so, as I was saying before, that is going to help to increase circulation, nerve conductivity, range of motion, while reducing, if not completely eliminating, inflammation and symptomatic pain signals. We also employ neuromuscular reeducation and therapeutic exercises to our treatments. And patients may even notice that we use some of the other adjunctive therapies. We call those modalities, such as electric stimulation, cold laser, other hot and cold therapies, in helping to manage and relieve our patients' pain levels. So in summary, we are connective tissue specialists. We are a physical medicine first and foremost, but we also incorporate nutritional protocols to help our patients healing inside and also affecting them externally. So we treat connective tissue disorders, and the most common way, layman terms, of what a connective tissue disorder is, I'm going to name a few for you: back pain, head and neck pain, joint pain, nerve pain, pelvic pain, inflammatory pain, just to name a few. I don't want to throw them all out there, but we're going to find that clinically, most of the conditions as it affects the human body are classified under connective tissue disorders. It's just not commonly known that that's the category to which they are in. So it's quite the honor for me to be at the helm of this type of education for the future doctors of naprapathy students. And additionally, I represent a very different face for this profession that's been in existence since 1908. I am the first Black and woman president of the institution.
Hey.
So,
Congratulations for that.
Thank you.
Yeah, now we knew you was important, and that's why we wanted to talk to you today.
Well, Dr. Griggs, I have a question leading into that. So you just named a lot of situations that most people go through, if not on a daily, sporadic basis. When would somebody come and see you? So do they have to go through another doctor to get like a specialty type of, you need to go see a specialist type of thing? Or like, how do they come and find you?
Oh, that's an excellent question. So we are licensed in the state of Illinois, and this is where we are. The college is. Home is in Chicago, Illinois, as am I. We are direct access practitioners, and that means that anyone can walk off of the street into any one of our offices. You do not need any type of medical referrals. We accept insurance. We can bill insurance. I mean, there are some of the things as far as if people have things like physical medicine in their coverage, that's the only way that that would affect a person's ability to have an insurance claim paid for our treatments. But for the most part, a person can walk right off the street and into our office. And you are right. I mean, we connect with everybody from that bus driver to that hairstylist to the nurse practitioner to the surgeon to anybody. We can treat anyone because the one thing that all of us have in common as human beings in this world is that we've experienced some type of pain.
Oh my God, where were you just 2 weeks ago? I just shared my experience on another episode of a little stress thing that I went through with my sciatica nerve. So, I should have walked right into your practice.
You sure should
We
Because,
definitely will help with that. I actually did when I was in the college, one of my presentations was on sciatica. So
oh
that's
my
actually something
God.
that I had to go a little deeper in. They give us topics of the different types of connective tissue disorders that we want to do our own projects on. And sciatica was one of the ones for me
Oh,
that
we're gonna
learned
have to
about it
talk.
a lot.
Oh, we're gonna be talking off camera. Off. You and I are gonna be having more conversations very soon about that.
Okay.
But
Okay.
what I want to tell people too about you. You're very unique because not only are you running. I want to make sure I say this right. It's Naprapathy. Ooh, am I gonna
girl.
mess that up?
Oh, we gonna get it. We got
Okay,
it. It's
Naprapathy. Naprapathy. Okay.
Naprapathy, and then
Yes.
there's Naprapathic. So yeah.
Naprapathic. Okay. You not only run that, but she is so diverse. How I found Dr. Griggs actually was on Facebook. She was talking and sharing some things way off she was going off the grid there. So that's why I guess she said you're an author, political organizer, community because she has a very diverse background. I want to talk about some of the other things that you do besides that. Let's give them a little glimpse into your life.
Okay. So yes, there are quite a few things there. For me, I don't know how that happened in life. So definitely I want to correct as opposed because I don't want to misrepresent and say that I'm an author yet. I'm an aspiring author because these works are in the mix. So that's one of the things. And it was actually motivated by my own experiences with pain, back pain, particularly during pregnancy.
Yes,
And
let's talk
even as
about
a
that.
pharmacist, yes, and even as a pharmacist, and I did most of my pharmacy career was with the Walgreens Corporation. So I was in a dispensing role, even though I still did inpatient, outpatient pharmacy on the side. I did academia where I taught pharmacy students. It was actually the compounding lab, the lab where we were actually making the medications. And so that I like to work with my hands. It's much like cooking, but and so I really enjoy it. And I ended up because I was talking about the book. So even in pharmacy, when a pregnant person came to get medications, there was extra care that we just been trained. It was just molded to be that way to look into them to make sure that whatever it is that they're taking or whatever it is that they're going to be prescribed, that it did not have an overwhelming negative impact on either mom or baby. And there were some times where you had to make the decision, is some of the more controversial, like the pain meds, what to do. I remember having a conversation with the OB-GYN before where I stopped a prescription. It was a Tylenol 3 prescription and I blocked it from being dispensed. And so the woman came in and she was saying she had migraines. And I spoke with the OB-GYN and we were talking and she said, I know, I know everything. She's like, but I don't know what to do to help her. She's,
Oh, wow.
and I understood because, that's That's now that I am a mom and I've carried a child, that is a very important time.
Mm-hmm.
And you want to make sure mom is happy. They're doing a lot of work and that body is doing a lot of work for them. So whatever relief we can give them, we definitely want to be able to do that. And it was because of having that conversation with the OB. I did release the prescription because the woman was in legitimate pain, excruciating migraines that she was experiencing. At the time of this story, I did not have my foot in the door of naprapathy.
Okay.
But and being in the dispensing role and seeing people legitimately in pain in my waiting area, waiting for those. And of course, we dispense everything, but it was particularly the people in pain where they're cringing in their seats in pain and you can see it. And you're trying to hurry up and get through your work because you want to help them so they can get home and get some type of relief. And at least for me, that's how it was in my practice. And so that, I don't know, in some way, and if that was the conduit or whatever, but the Mommy Hurts series talks about that because of the pain. A lot of women may say, oh, my pregnancy was fine. It was a breeze, but that's not every pregnancy. And that's not every woman. And so what do we do for them? How do we help them? And it was a blessing that I was actually in that school in my internship. I was in my clinicals with my first pregnancy, one of my pregnancies there. And my classmates, my fellow interns were able to help me and treat me. And I didn't have to suffer as much.
So you were experiencing your own personal pain. You had personal pain during your pregnancies?
I did have pain as well. And so it's, again, sometimes, like maybe in the first earlier ones, not so much. In my life, I've had a total of 5 pregnancies. And so I only have one surviving child. And so there are different things that happen to me that I discuss in my Mommy Hurts series. And the first series that's going to come out, of course, of Mommy Hurts is the Hope After Horror. And it goes over things like infertility, recurrent pregnancy loss. I've had miscarriages. I've had preterm births. I've had the ectopic pregnancy. I've had, my right fallopian tube, that's where that pregnancy was. And it was not only was that pregnancy removed, but that section of the fallopian tube was moved. And my now 4-year-old is my miracle baby because he came after all of that, after I probably checked out. Yeah.
You know what? This story resonates because actually we got a question in our Facebook group from a woman that wanted us to talk about infertility, and she struggled with some of the same things that you're talking about. I think she had like 6 pregnancies and only 1 child so far. And she talked about that, and we talked about breastfeeding on one of our episodes. So it's kind of, this story resonates with a lot of women. They really do have struggles there.
Yes. When I was on a lot of those pregnancies, once you have 1 or 2 adversities, you're automatically put into the realm of high risk. And so I spent a lot of time going to different blogs and finding that I was not alone and that there were millions of women out there going through that. And I had a unique medical knowledge base too, that I was able to, when I got pregnant with my now son, there were things that I hit the ground running doing that I wasn't necessarily aware of before. And that is the basis to which that first series of Mommy Hurts to really help them get through the coping and the mental healing of what it takes to get through that and get into the mindset when you get pregnant again. And so just to try to tackle that again, there's wounds. So we have to address that. And then what are the things that they can do health-wise to help them along the way, and how to work with them in their OB-GYN needs along the way, just to give them more options. So that's one of the stories of Mommy Hurts.
So Dr. Griggs, you spoke something that we've been talking about a lot lately, which is mindset. So you carry a lot of hats. You've been through quite a bit of a journey. Can you talk to us about your particular mindset and how it's evolved in each stage of your life?
Oh, wow. Well, thank you for asking that. I was listening to you guys earlier and I said, wow, this was divine for you guys to even mention mindset. I actually have an event tomorrow, which more is an encore event about mindset. I am 100% about that. It's a vision board extravaganza, it's virtual, but we do talk about mindset in there. I like to keep the same quotes that's on with all of my advertising, that every dream starts with a vision. And that's something that's in your imagination. It starts in your mind first. And so what people have to understand is that, and we see these quotes all the time, whether you think you can or you can't, either way, you are right, because you're the one that's going to determine. I remember in grade school, there was a poem that I had memorized, and I wonder if I still know that you are the person who makes up your mind. And it touched me at such a young age that I always kept that in mind, coupled with my mother always saying when I was little, you can do anything you want to, baby. Anything you put your mind to, you can do it. It's so cliche, but it's very powerful. And that is the type of impression you certainly want to put on children, not to go off too much on a tangent, but helping people to unlock that is one of the things that I have set out to do first, because that also helps in their healing. I can employ as many things as I think to help your body, but if I don't have your mind helping me, working with me, you can actually cancel out the good things that I'm putting in. And I've had those situations with patients where they didn't believe it. Now, the one thing that I haven't experienced that with naprapathy. And I don't know what that is. I remember I was treating a guy I was dating before. He had a crook in his neck. And I said, come here, let me, I wasn't in an office. I was on this weird shaped couch. And I started to do some joint mobilizations, and I'm working with his head and stretching and doing all of this. And after the fact, he told me this after the fact. He said, wow, this actually helped. I didn't think that was going to work. And I thought to myself, like, wow, I'm still amazed that you got relief. But when he got relief was the fact that the movements and some of the things that I was doing actually put him to sleep. So he was no longer thinking anymore. And I was allowed to do what I needed to do for him. And so that is why even in my offices, we get people in a more relaxed state of mind with those meditation music, things to relax them so that conscious mind isn't so overactive, as I believe Akila was saying, and I hope I didn't mispronounce your name, but as she was saying before, those anxious thoughts and you can't stop, and just to kind of just stop, breathe, relax. He was able to be helped, I think, because of the subconscious healing power. His conscious mind was not there to neutralize the things that I was doing. So that when he woke up, he was like, oh, wow. I didn't think that was going to work at first. And I was like, wow, that's amazing. So what you think is very powerful. What your thought process is, your attitude, word of the year, attitude. What that is going into a task is definitely going to determine its outcome. So I'm a huge advocate on mindset and positive mindset. But it's more than just telling people to think positive. It is definitely something that we have to give them steps to do. I like how Earl Nightingale put it when he was talking about that pilot that goes over that checklist of things before they actually take the plane off of the ground. And I think that in our approach, and I teach that in this workshop, our approach to our daily lives, and this is just to piggyback off of some of the things you guys said in the program, those affirmations. I teach people to make those affirmations, to say good things about themselves, get in the mirror, recite them, write them down every day, like Bart Simpson was writing the same stuff over and over on that chalkboard. Keep writing it over and over and over again so that your mind can keep seeing it, reading it, taking it in. That subconscious mind is working even when you're not even conscious of it. It's still working. So if you're planting those type of seeds of goodness and virtue and positivity, that is the experience that you're going to have. And it's going to take that repetition for you to experience. And one day you'll go, oh my God, that worked. And you'll find, and I mean,
Yes.
It's real. It
Yes.
works.
Yes.
Like the
Yes.
late and great
Yes.
Johnny Coleman says, it works if you work it. And so we have
I
to
remember
teach
that.
people how to do that consistently over and over again, so that we can't necessarily control the thoughts that come into our minds, because all kinds of things can come in. But what we can control is what we dwell on. So when you see that thought, or when that thought comes in that's negative, when you're doing these affirmations, and just like the young lady was saying with the mirror work, when it comes in, it can be kicked clean out just as fast. And I have noticed that even in my own interactions with people, my that
Wow.
these affirmations, doing them consistently, that even when something negative comes in, and it does, and it will, I do know that I have a resilience and a little strength level that kicks it right on out, and I can get back to the good things I was thinking about.
Wow, this is very powerful information. I mean, we're all saying the same thing over and over again to our listeners, and we know that this is a breakthrough. But there's somebody out there that really need to hear this. Before we wrap this up, Dr. Griggs, where can people find you if they want to reach out to you?
Oh, I'm definitely on Facebook, Twitter, Instagram, YouTube, Clubhouse.
Oh, you're in the Clubhouse.
Don't ask me how I'm keeping up on all of this, but it is exhausting. I am at Dr. Shanté RX, all one word, at all of those platforms. Oh, and LinkedIn. I forgot about LinkedIn. You can definitely find all of my professional pages on each of those platforms that I mentioned, Dr. Shanté RX, all one word. And also, if people need anything as far as naprapathy services, we're not just a college, but we're also a community clinic. And if a person opts to be treated by one of our interns, they can get the treatment at a discounted rate, as opposed to what it will cost for the licensed practitioner. But we do still accept insurance. And you can also find that on our social media pages at NapMed 1908. So it's the National College of Naprapathic Medicine and the NapMed Pain Clinic. We're at 3330 North Milwaukee Avenue, and that is in Chicago. And They can also find us online at www.napmed.org and napmed.edu.
Nice. And so we always do this amongst each other, my mom and I, and we're going to ask you the same thing. Can you give us an honesty moment of the week? We always close our podcast out with just a revelation, whatever. We like to keep it real because we're not perfect by any means. None of us are. And we want to make sure that we understand that we all go through somewhat, if not the same thing. So can you share with us an honesty moment of this week?
Honesty moment of this week. Wow. I would say, and this is because I'm still in the whole mood of the mindset and affirmations, and when you're writing things in your journal, to be honest with yourself and to write in your journal and write what you believe, what you want, write out your truth and face it.
Yeah.
And that definitely helps.
Very good.
I've been challenged with that. And I'm only saying it because I was not doing that at first. I just started this month, and I would give that for everybody else to do. Challenge yourselves to just be honest with yourself. No one's going to see it with you. Yeah.
Okay. Very good. Keela, what's yours?
Well, this week, I think I want to continue because I've been on the same path of just trying to find balance and loving on myself and being patient with where I am. But honestly speaking, I had to catch myself maybe the other day because I found that little nasty thief of joy called comparison sweep through me for a second. And that's because I was paying too much attention to other things and not enough attention to what I was doing. And so it kind of, but I'm glad that when it started to creep up, because I'm human, I've been doing so much self-work that I didn't allow comparison to overtake me. If anything, I recognized it. I didn't beat myself up about it, but I was like, okay, now we're going to be done with this because your path is your path and your path is the right path and not anybody else's. So that's what I honestly went through the last couple of days, but I swiftly got up out of that.
Very good. Sounds like you did. You took Dr. Griggs' advice. My honesty moment was I've been beating myself up because I do intermediate fasting and I've been kind of off grid here for the last week. Normally, I will stop eating at 7:00 in the evening and will not eat again until 2:00 the next day. And I've been doing this for almost 3 years. And I took a break and I decided that I needed a break. And I had to be honest with myself and say, why do you need this break? Well, when you keep doing the same thing over and over again, your body gets used to it. And it wasn't as effective as it was before. So I need to switch it up. So I had been doing some research and decided I would try a different fasting method because I really do believe in fasting. That's one of the things that earlier when Dr. Griggs was talking about new cell generation, that's one of the quickest ways to do it, is to fast. So that's one of the things that honestly I had to go back and say, okay, how I'm going to do this a little different. But I'm working on doing it a little different and continuing on my path. So
good for you, Andretta.
So we want to thank Dr. Griggs. Is there anything you want to leave our audience with before we sign off today, Dr. Griggs?
Oh, I feel like I've been over talking and I didn't know you guys meant that when you meant by honesty moment, like actually something within your self. So what I will add to that is that I have been trying to get back to making my vegetable juices because of the detox program that I do. And I've been going to the grocery store, buying the kale, buying the apples, the ginger, doing all it. And the stuff has been going bad because I haven't sat down.
I think we all can relate to that.
Time to do that. So if that was the level of transparency that you guys were looking for,
there you go.
That was my thing this week. But I am going to make a video because I'm going to juice that stuff today. So when we're done, I'm going to make a video and I'm going to tell everybody I slipped this week, but I'm going back.
See, I'm so glad. That is true across the board for everybody.
I don't know how many times we bought vegetables and tend to juice them and we don't. In fact, I wind up at the health food store. I know, and I wind up at the health food store buying a juice. And
you feel bad because you done spent all this money and it's just like, now I just don't even have it in me to juice all of this. It's true.
Oh boy, well, this is a great interview. We were so glad that you're here.
Thank you. I had so much fun.
Yeah, we're going to invite you back from time to time because I have a feeling that we just scratched the surface with you.
Yeah, I think we just scratched the surface. Dr. Griggs.
Yeah, I think she got a lot more to say and to contribute, but we want to keep our audience, we want to keep them listening. Yeah. I know you got a lot of stories and I can't wait to hear some more of them.
Stories. Oh my goodness.
I could tell by looking at your Facebook group page. I said she has a lot to say. I think you and I went off on a cryptocurrency thing the other day.
Oh yeah. Oh, my phone has been dinging because that XRP is on the move. And so I've been trying to tell people. I've been trying to tell them, but okay.
Yeah, I said I was going to even jump over there and join your group too. And look, I can't be in too many groups with the cryptocurrency. So we're going to talk about that too another time because, what we say, health is wealth, right? Wealth is health. Okay, we're going to wrap it up. Thank you again, and we'll see you guys on our next podcast.
Bye, everybody.
Bye-bye.
Thank you for listening to Well Honestly, the podcast. If you want to know more about us and our products, check us out over on our website at brownwomenwellness.com. And remember, ladies, we are not doctors, and any information shared by us is not medical advice. Always follow your doctor's advice.
And don't forget to rate and review our podcast and let us know what you loved about this week's episode. And please subscribe to wherever you listen to your favorite podcasts. Feel free to email us and let us know what you would like to hear more of from us. Don't be afraid to say hi. We'll say hi right back to you.
Don't forget to find us across all social platforms at Brown Women Wellness. As always, show notes with the links to what we talked about today in this week's episode will be in the description box below. Thanks for listening.